All right, guys, thank you all for joining us this afternoon. If you'll give us a second, we are working to get everyone recording privileges. If you don't have those in the next minute, just let us know in the chat. So today we have Dr. David Kimberlin, who's the co-director of UAB and Children's Division of Pediatric Infectious Diseases. He's going to be discussing what he's seeing with pediatric COVID cases, how to keep your kids safe with the Delta variant, and just ways to prepare for the upcoming school year. If you have any questions, please raise your hand using the Zoom function, or you can drop your questions in the chat. We will provide a recording of this later. And to start off with, we're going to have a few words from Dr. Kimberlin.
Good afternoon, everyone, and thank you for your time today. This is another in a series of interviews that I and others have done, trying to raise awareness of just how bad things are right now in our city, in our part of the state, across the entire state, and indeed across the entire region and country. The difference now is the Delta variant. I know that we would rather not be talking about masking in schools. I know we would rather not be talking about masking when we're indoors. I know we'd rather not be talking about the possibility that businesses will be limiting people coming in unless they're masked or unless they're vaccinated. I would like to be talking about something different as well, but the variant that is now circulating widely in Alabama and across the United States, the Delta variant, has changed the game. And because the enemy has modified, has mutated into this hyper transmissible, hyper infectious version, it forces us to then modify what we're doing to try to keep people safe and to keep people well. So what we're going to be talking about over the next 30 minutes or so, I would expect, will increasingly be discussing the transmissibility of the Delta variant and the way that it is spreading, not only among adults now, but in, among children too, widely spreading, fastly, rapidly spreading among children. And it's filling up our hospitals. This is not just in Birmingham, this is across the state. Mobile's getting hit hard, Louisiana's hit hard, Mississippi's hit hard, Tennessee's hit hard, Arkansas's hit hard. This is our reality right now. And I appreciate very much y'all's involvement here to try to get the word out to the public of just what we're facing. It's going to get worse before it gets better. And I fear, since we're already starting out in a place that, arguably is as bad as it was in January and February right now, we're going to end up in a place that we have simply not seen before, with a virus that is so transmissible as to make last year look pretty tame. So that's not positive, uplifting kind of sentiments here or messages, but it is factual, and we do need to try to get the word out as best we can. So I appreciate very much you hearing that intro. I'm happy to take any questions you may have.
All right, thank you, Dr. Kimberlin. As a reminder, if you have any questions, you can raise your hand or drop them in the chat. To start off with, I think a very basic question would be, with parents and kids, what are some symptoms that parents need to be on the lookout for their kids moving forward?
Well, the Delta variant is still a form of the COVID virus. And so the same kinds of things that we now are so familiar with, it's a respiratory virus, so it's respiratory symptoms, cough, runny nose, sore throat, congestion, loss of taste and smell, not unique completely to the SARS-CoV-2 virus, the virus that causes COVID, but pretty suggestive if you have a kind of a rapid onset loss of taste and smell, that may be the cause. Sometimes some GI symptoms as well, diarrhea, vomiting. We're seeing perhaps less of that with the Delta variant, but I think we're also very early into our experience with the Delta variant to know whether that's simply a manifestation of what's happened over these last few weeks, or is it something a little bit different with the virus? The main thing is twofold: respiratory symptoms, since it's a respiratory virus, and that's going to be the cold type symptoms that you're familiar with, cough, runny nose, congestion, and sore throat. And especially in the unvaccinated adolescents, since everyone 12 and over can be vaccinated now, in unvaccinated adolescents and in younger children who are unvaccinated because they're under 12, you likely will have other things like headache, fever, and so on that can be part of this too. So the overall things that parents should be watching for really are not that different, if any, from what we got so experienced with in 2020 and in the first half of 2021. The difference here is how incredibly transmissible this virus is. The only virus that we know of right now that's more transmissible, that's more easily spread than this new Delta variant of the COVID virus is measles. And measles is like a heat-seeking missile that will find whoever is not fully immunized, not fully immune to it. So I have a fear right now of what lies ahead. This is not the same virus in the way it's behaving that we got used to last year and in the horrible dark days of last winter. This is even worse. And that's the reason we need to be getting the word out to people that they need to mask indoors. They need to get vaccinated if they're 12 years of age and older and have not been vaccinated yet. And we have no time to waste. It is that kind of urgent, and it's that kind of an all hands on deck moment for all of us in Alabama and really across the Southeast and across the United States.
All right, thank you, Dr. Kimberlin. Chastity, I see you have your hand raised if you would like to unmute yourself and ask your question.
Thanks, Hannah, and thank you, Dr. Kimberlin. So my question today, kind of focusing, obviously we're back to school right now, and there are some schools that are mandating masks, some that are making them optional. So how can you explain like the best practices for schools if there's an outbreak, mandating versus optional?
The best practices undoubtedly are to have mandatory masking in schools. That's supported by the Centers for Disease Control and Prevention, by the Alabama Department of Public Health, by the American Academy of Pediatrics, by the Infectious Diseases Society of America, by the Pediatric Infectious Diseases Society, by all pediatricians in North Central Alabama that have signed on to a letter advocating that. This is something that I really beg those school districts that have not yet required mandatory masking, I beg them to listen to the uniformity of voice here. This is not, a few say this, a few say that. This is totality of commitment that masking, mandatory universal masking in schools is our best way into and through what is immediately in front of us. Now, I also want to say that with how hyper transmissible this virus is, we probably, even in schools and classroom settings where there is a mandatory mask mandate, we probably will see some cases. This is that kind of transmissible, that kind of infectious in terms of what the virus can do now with this Delta variant. But what I really, really fear, and I don't want to set up this experiment where one school system says, well, it's going to be optional, and then schools around them are saying, no, it's mandatory. I really fear what we're going to see are those that are not following the strong recommendations of the Alabama Department of Public Health that mandatory masking be the accepted practice in schools. Those that are not following that strong recommendation are going to be, I fear, going to be seeing a lot of cases. I mean, look up in Missouri, look over in North Carolina, look in Mississippi. These are schools that opened with optional masking, and within 2 to 5 days, we're closing classes. I really think, I have no crystal ball. I have a lot of experience. I think that we will end up being masked in schools. I think that the Delta variant is not going to give us a pass on this one. I would argue, I would suggest, I would posit that it makes most sense to mask from the beginning. Why let it get bad and then react to that? Why not do something to try to keep it getting bad in the first place?
I'm sorry, just one follow-up question to you. So is there a difference between how those outbreaks would be handled? Like if you're in a mask mandated school, would quarantining look different from a school that's mask optional?
I think each school system will have their own response plan, and in terms of what they will do as cases are identified. What I would recommend is that include contact tracing and really aggressive testing. What we saw in March and April of 2020, was a situation where we were blind to the battlefield. We did not know where the enemy was because we weren't able to test for it. Well, we're in a different place, in August of 2021, in some ways worse because we're dealing with the Delta variant, but in some ways better because we do have vaccines that can protect people 12 and over, and we have testing capability and capacity so that we can see where this virus is to a very large extent in the classroom and in the school setting if we're looking for it, if we have the willpower to go looking for it and then respond to what you're seeing. Now, CDC and others have recommendations on what people who are immunized, vaccinated against COVID, what they need to do if they're exposed. And it does not include quarantining anymore if you're vaccinated. Now, a school system may still want to quarantine. They may have their own balance for that so that they can best contain the virus when it hits their school, and it will hit their school. On the other hand, a really great source of information is the CDC website. And it shows clearly the benefits, the advantages of being vaccinated if you're 12 and over and you're able to get vaccinated, because it means you don't necessarily have to quarantine. You are recommended to be tested 3 to 5 days after the exposure to make sure you've not asymptomatically acquired this Delta variant and therefore possibly be able to transmit it to others. But for those that are unvaccinated, and that would include everybody under 12, it will mean quarantine again in order to try to contain the virus spread. Now, some schools might be more aggressive with that than others. I would advocate that they all should be aggressive with it because, as I said before, this virus is not going to give us a pass. This Delta variant is a different type of virus than what we faced last year and what we faced last winter. And think how bad it was then. It's going to be worse now.
Thank you.
All right, thank you, Chastity. Another question we have is, are severe cases or even death a threat for children with the Delta variant?
Yes, I'm not prepared to give numbers of patients that are admitted to Children's of Alabama, for instance. You can talk to their media group and get the specific numbers. I talked with folks down at University of South Alabama for their numbers as well. We are seeing more patients across the region, children, pediatric patients that are admitted to children's hospitals across our part of the country than we saw last year. We also have, 90% of the cases Delta variant. So I don't think you have to really do a lot to connect those two dots. The Delta variant is hyper transmissible. It is infecting more children. It may be making each child who's infected more sick, or it may not. That's not yet determined yet. It appears that the Delta variant can make adults more sick, twice as likely to go into the hospital, 4 times as likely to end up in the ICU, twice as likely to die. Not clear whether that same increased risk per person infected is the same for children as for adults. But in some ways, that's kind of a semantic argument or discussion because so many more children are getting infected. Therefore, so many more are going, even if they're not individually more likely to be infected. You get a whole lot more people infected, you're going to have a whole lot more that are severely infected and affected by this, and therefore need to come into the hospital. So, long-winded answer to an excellent question. This Delta variant is a new entity for us, and our hospitals are filling up, not just on the pediatric side, but even more so on the adult side. And we have all got to buckle down here, and we've got to do our part. I know we're tired. Believe me, I know we're tired, but we got to do it. If we don't, this virus will be running amok among us, and we cannot let that happen.
All right, thank you. Trisha, would you like to unmute and ask your question?
Sure, thank you. What do you say, we're communicating with parents who are really torn in these mask optional parents who are worried about the safety of their children or children bringing it back. They're thinking virtual school. Some of them, we're just pulling them out to homeschool, in these mask optional districts. What do you say to parents who have this really difficult decision to make about, I don't want my child to get sick? Is the choice really keep them home in these mask optional districts or homeschool them?
that probably is the toughest question I'm going to get today. There are no good answers to it. One thing I would say, and I think for the parents that are asking this kind of question, they probably have already done this, but if your child is 12 or over, get them vaccinated. If you have cousins that are 12 and over, strongly encourage their parents to get them vaccinated. Vaccines are going to be ultimately what get us through this, although not for these next few weeks, because even if we start increasing our vaccination rates now, it's got, we got to give the second dose 4 weeks later, or 3 weeks later rather, for Pfizer, and then we have to wait 2 weeks thereafter. So it's not the immediate answer, but it is part of the answer that ultimately gets us to the other side. So that's number one, get your child vaccinated. The other thing is to use your voice. Parents they have power, and with their superintendents or their members of their boards of education in those districts that are optional at this point, that are not requiring masking, don't do things in a polite, nice way. Don't go shaking your finger at them or anything, but reach out and say, look, I am really concerned. My son, my daughter, can't get vaccinated right now, or they have a weakened immune system, or they have asthma, or I'm just scared to death they're going to bring it home and give it to my parents, their grandparents. All sorts of stories that we know will happen. Make sure that the folks making those decisions in the district hear that side of the discussion as well. They hear a lot from folks that are angry and loud. They do. I think that the folks that are concerned and that are behind the type of question that you pose to me, I think they're the majority. I think they're quieter. And I think now they're realizing that they need to be more active, and they should be more active. This is a democracy, and we need to let people know politely and with civil discourse that we're concerned. So that's the second thing. The third thing is to think about pulling a child out of school is, I think, an even more difficult decision in August 2021 than it was in August 2020. We now have a full school year plus, the spring part of the 2019-2020 school year to realize with really empiric data that homeschooling, virtual learning is inferior to in-class, in-person learning. It's inferior from an educational standpoint, from a mental health and psychological standpoint, from a socialization standpoint, from a physical health standpoint, from a nutritional standpoint, you name it. And we all recognize that. So in some ways that's better. A year ago, we were arguing about it. Now everybody agrees. So the question then is, how do we do it as safely as possible? It doesn't do us very much good to launch into a school year only to have to stop in-person learning because the virus is running crazy, throughout the school. It does better to be thoughtful in the way we approach it to try to keep children in school once we get them in school. And right now, my default is that children, even in mask optional districts, should go to school. That's right now. I could find that to be an ill-advised comment a week from now if things are as bad as they may be. And that's why it's such a tough question. There is no one right answer. There's certainly no harm in it. There's nothing wrong with a parent saying, no, I'm not going to do that for my child, or at least not to begin with. I'm going to have them at home. That's a decision a parent should make for their families and their children. But we do know the negatives of that also. I wish we had better options right now. And the lay of the land is pretty much as my lengthy answer just kind of put out there in front of you, as I see it anyway.
Can I follow up with one? Flip the coin. Parents who say kids aren't getting real sick. I was at a board meeting last night where a pediatric nurse stood up and spoke to the Hoover board and said, hey, kids aren't getting that sick. Y'all are overblowing this. And there are a lot of parents that really believe that. And what do you say to them? I know you've said it a lot already, but if you're directly speaking to parents who don't believe their children need to go to school in masks, like it's all overblown, what do you say to them?
I have been a pediatric infectious diseases physician for 27 years, I believe. I have studied virology for 25 of those 27 years. I am the editor of the American Academy of Pediatrics Red Book, which is referred to as the Bible of Pediatric Infectious Diseases. I'm an associate editor of the main Pediatric Infectious Diseases textbook. I am the AAP liaison, one of two, to the Advisory Committee on Immunization Practices, the committee that advises CDC on all vaccine issues, including the COVID vaccine issues. I know what I'm talking about. This virus is the real deal. And it does cause severe disease in children. And we are ill-advised to take it lightly. Now, will a lot of children be fine from it? Yes, thank God, yes. Will some children not be? Yes. And do you want your child to be that 1 or that 3 or that 10? Do you want that? I think not. All parents love their children. All parents want what is best for their children. We need at this moment in time to listen to the experts who are in the field day in and day out, your general pediatrician who's frontline and she's working with you and your family. We need to listen to her. We need to listen to the pediatric infectious disease folks, my colleagues, hopefully myself included in that. We need to do this now. This is not a time to go cherry picking who you want to believe. Go to the CDC, go to the American Academy of Pediatrics, go to the professional societies and listen to them. Don't listen to the individual lone voices. I don't know the speaker from last night at the board meeting. I don't want to disparage her because I don't know what she said. I wasn't there to hear it. I do know what I'm talking about. This virus will do devastating damage to our children and to our adults in Alabama. And we need, listen to my voice. I don't normally talk like this in press conferences. We need to know this and we need to be responsive to it. And responsive means get vaccinated if you're 12 and over, put a mask on when you're inside. And since schools are inside, everyone should be masked inside. That's what we got to do.
Thank you.
All right, thank you, Dr. Kimberlin. Kind of staying on the topic of masks in schools, there's some out there who just refuse to believe masking helps in any way. They sometimes cite sources to support these claims. Why, from your perspective, should people believe that masking helps mitigate the spread of virus? What are you citing that makes you believe this?
I'm citing scientific data that have shown it over and over again. Not the one-off, pseudo journal, pseudoscience kind of stuff that you can download. But think about this. If the CDC, if the American Academy of Pediatrics, if the Infectious Diseases Society of America, if the Pediatric Infectious Diseases Society, if all of them with all of their scope of expertise have looked at the totality of the data and they say masking works, do you think you're going to find the one article that they missed that's going to disprove all that? Or perhaps should you just take their word for it? Because they have done the deep dive. They're the experts in the field that know how to interpret these data. And it is uniform in the recommendations that they're providing. And that is that when we're indoors now, because of this hypertransmissible Delta variant, that we need to mask. We do. I'm sorry about that. I wish it weren't true. I really do, but it is. So we do. I mean, we got to do it. And I think all you really have to do as well to think about, well, masking doesn't work. I would turn it around and I would ask the person who might have that view, think about last year. Think about March 2020 to May 2021, somewhere in that range, when we were wearing masks all the time. Did you get sick as much during that 14-month period of time as you normally would have? Did you have colds last year? Did your child get bronchiolitis with RSV when everybody was masked and socially distanced? We didn't see those viruses at Children's of Alabama. We run the diagnostic virology lab. We quantify all the viruses every week that we're seeing. We didn't see them because they weren't there. Why weren't they there? Because of masking and social distancing. It works. It works. I don't need to be, have proof shown to me every day that gravity is real. I believe that it is. I'm sitting in this chair. I'm not floating up off of it. It's that kind of it's a flippant answer, but it really is that kind of an acceptance that we need here. We are going to sit around and argue about all the deck chairs on the sinking boat until we all drown, unless we pull together and say, all right, I don't like it, but I'm going to put the mask on when I'm inside. I don't necessarily want the vaccine, but I'm going to get it because I'm 12 or over. That's what we've got to do to get to the other side of this. We've got to.
Thank you, Dr. Kimberlin. A lot of parents have their hands tied with their children who aren't eligible to be vaccinated. They have babies all the way to middle schoolers. What do you say to those parents who are scared about how to protect their children?
I think my answer would be that we know how to protect children, and we know how to protect adults as well. We did it last year, even before we had the vaccine. We know that masking decreases transmission. We know that social distancing decreases transmission. We know that vaccines absolutely decrease severe disease and decrease the likelihood of getting infected in the first place. Even with this Delta variant, we know that the vaccines are still strongly and highly protective. So what I would recommend that they do is use common sense. Make sure everyone that's around the child under 12, that everyone who's 12 and over or around that younger child get vaccinated, that everyone masks, not in your home. I mean, go back to the way it was last winter, basically. And that was enough to get us through then. And I pray that it'll be enough to get us through now, but it's going to require everyone doing it. It's going to require us in our society, which means everybody, it's the totality. It means that we've got to do it for ourselves, and we've got to do it for our neighbors. One of the things I strongly believe is that Alabamians are good people and faithful people. I know that a faith-based life is how so many Alabamians, myself included, strive to live every single day. Well, what's more fundamental to Christianity than helping your neighbor and doing things that protect your neighbor? That's what we're talking about here. I know there's individual liberties. I get all that. I can make an argument that an infectious disease is separate from that for various reasons and so on and so forth. But I also know that Scripture says that we should take care of the least among us. And that's what we need to be doing right now. And right now, the least among us are the 5-year-olds and the 7-year-olds and the 15-year-olds with asthma and the 70-year-old with cancer and the 45-year-old with Crohn's disease on an immunologic agent that's weakening their immune system. Those are the people around us that we have to be mindful of and we have to take care of. God has told us to do that. And so our answer ought to be, yes, we'll do it.
All right, thank you so much. I think we've covered all of the questions that we've received. Is there anything else that you would like to share before we conclude? Actually, one moment, sorry. We do have one more question.
Okay.
Quick question. As you mentioned, over 30 pediatricians in both Shelby and Jefferson counties have joined together to petition schools to enact mask mandates. How crucial is it for school boards to shape school safety protocols based on scientific data and medical professional input? Schools begin again.
It's critically important that they listen to the physicians and the scientists and what is being stated with uniformity of voice. That's just critical. And if we don't, we're going to end up in a bad place. And even if we do, it isn't going to be smooth sailing. But it is, the roadmap is in front of us. What do we need to do? We need to take a little piece of paper and put it in front of our face when we're inside, and that includes in school. It isn't that hard. It's just not that hard. And we need to get vaccinated. And we need to, use common sense and be mindful. And so please listen to the doctors that you trust. And those are the ones, if you're a parent, those are the ones you take your children to. You would not take your child, I hope anyway, to a pediatrician you didn't trust. And when she says, or he says that it's important to mask, as virtually every pediatrician in Jefferson County, and I believe Shelby County has done, listen to them. that would be my recommendation.
All right, thank you. And now we're going to go ahead and wrap up. So if you have any final words, closing statements, go ahead.
You know, I need to reflect on this media session here a little bit. I think it probably will, in a reflective way, looking back, be something I see as the most unusual I've ever done. I'm strident. I am scared. I'm much more direct in the way I'm saying things than I normally, am. I'm more passionate here than I normally am during these kinds of question and answer sessions. And all I can say is there's a reason for that. And it's because I see what's coming, what is really hitting us already, and what is about to just absolutely slam us and knock us down. And we don't have a lot of time. And yet we, the collective community, seem to be arguing about things that we already know work. And that really don't take very much. Again, to put a piece of, paper or cloth in front of your face, it doesn't take that much. And we don't have a lot of time to get to the other side of those arguments. And so my plea, it's a plea, is that we please listen to the health experts. And we do what we may not want to do, but we got to do it. And we got to do it now. And so I'll end with that. I want to thank you for your time and your attention today. And I appreciate everything you're doing.
Thank you so much, Dr. Kimberlin, for taking time out of your busy day. And to everyone else, like I said, we will send a follow-up recording later. Have a good day.